Okay, hello everyone. My name is Luki Sarjono Buranda. I am a medical student of Tadulako University. As a medical student, I have concern on people's health. There are so many diseases that need better treatment and strategies to prevent them being happened in the society. Today, I will tell you why we must pay attention on people's health, especially in the maternal health. Maternal health is one of 8 Millennium Development Goals that must be achieved on 2015, which every nation under United Nations organization must responsible to realize increasing maternal health. Now, we're gonna see the message of the 5th goal of Millennium Development Goals. You have seen the 5th goal of the Millennium Development Goals, and now we need to know the most causes of maternal death. There are 4 most causes of the maternal death: postpartum hemorrhage, thromboembolism, infection, and hypertension. Since the most cause of the maternal death is postpartum hemorrhage, we need to know the etiology of the postpartum hemorrhage. There are 4 most causes of the postpartum hemorrhage. We also know as 4T. The first T is stone, second T is tissue, third T is trauma, and the last T is thrombin. The first T, tone, it means the uterine anatomy, or we know as incapability of myometrium to contract in order to stop the bleeding. The second T is tissue. It means incomplete placental delivery, so myometrium can't be contracted in order to stop the bleeding. And the third T is trauma, means trauma during delivery process. And the last T is thrombin, means defect of coagulation process, or physiological hemostasis cannot be done in the patients, so the bleeding is still out. Soon after the placental delivery, the myometrium contracted. The myometrium contraction compressed intramyometrial artery in order to stop the bleeding. If the bleeding have not stopped yet, we also can use uterotonic agents in order to induce the myometrial contraction. We can use oxytocin, mostly used as the first line of therapy, and if the bleeding still cannot be stopped or oxytocin isn't provided, we also can use ergot derivative and misoprostol. If the bleeding is still persistent, we can try to use intrauterine balloon tamponade in order to stop the bleeding permanently or temporarily while the patient transferred into the referral location for further medical procedure. Now, after we know about the maternal health, I hope we all have responsibility to reduce the maternal mortality rate and also to help our government to achieve the 5th goal of the Millennium Development Goals. I am Lucas Sarjono Buranda from Faculty of Medicine and Health Science, Tadulako University. Thank you very much.